We are. Cool. Hey everybody. Welcome to our first live stream here with the virtual town hall for AYD.
We are.
I am Matt Royer.
Hey everybody.
Sorry, having a little bit of sound problem. I'm Matt Royer, Vice President, and with me is Katie Cristol, the one of our county board members here in Arlington. Thanks for being on, Katie.
I'm really glad to be on. It's good to see you, Matt, and thanks everybody for tuning in.
Yeah, thank you so much for everybody at home who's watching. So first off, we're just going to get into some of these, some of the questions here that we're going to be talking about. So far, how has the county handled the COVID-19 pandemic?
Yeah, so one way to think about the county government's role is that we're anything that the feds and state aren't doing. So that's been everything from working on our crisis response for some of our most vulnerable folks, seniors, folks with disabilities, low-income people, and ensuring that we have direct response available for all of those individuals in our community, whether that's been emergency financial assistance for rent or telemedicine and telecounseling for our behavioral health care patients. We have also played a role in working with Virginia Hospital Center to establish testing collection sites. You may have seen that there's one off Quincy Street across from Washington Liberty High School. And we've been working, I should really say our staff has been working, specifically our public health director and emergency manager have been working really closely with all types of partners. So fellow jurisdictions, the state, and then also again with our major hospital, Virginia Hospital Center, and other healthcare providers, so that we are aware of what their needs are, aware of what their plans are to address surge capacity, and helping disseminate those messages effectively to the community. The other big thing that the county has been doing is thinking about our role in small business assistance and unemployment assistance. So helping through our Arlington Alexandria Workforce Council get word out to individuals at risk of losing their jobs or who have lost employment, as well as working through our small business support team called Biz Launch at Arlington Economic Development to help communicate with our small businesses who have been so dramatically affected, if not by the virus itself, then by our attempts to slow the virus and pursue social distancing.
Awesome. So it seems like, y'all really have your hands full at the moment. Did you feel like our emergency preparedness here in Arlington was equipped and up to speed to handle something of this magnitude, or were there some hurdles along the way?
Yeah, if I can give you all on the video chat any confidence in anything, I hope it's this. We have such an extraordinary team in Arlington. Our deputy county manager has oversight into public safety and technology, was our man on the ground on 9/11, really managing fire and EMS's response to the attacks on the Pentagon. Our public health director is extraordinary, of course, is a medical doctor himself, and oversaw the county's response to H1N1. Our emergency manager is the newest team member to that team, but came directly from New Orleans, where he was trained in emergency response in the wake of Katrina. So we have people who are absolutely tested. They're making excellent decisions. They are briefing us as board members, but I think actually it may inspire people to know that we amateur elected officials are not actually the ones making critical decisions, for example, about when and whether to quarantine EMS members or how to handle hospital surge capacity. We're being briefed. We're your eyes and ears and trying to communicate that out. But you have professionals with an extraordinary amount of expertise who are really forged in the fire of previous emergencies, making some good calls right now.
Well, that definitely sounds like something that everyone can sort of be behind and really feel like we are definitely being taken care of here in Arlington. So what has been the biggest hurdle to get over so far with all of this? I know that, this was not anything anybody was expecting to deal with this year. And I don't think that as you head into your second term, this was the first thing that you thought would be on your plate. But, what have you seen that's sort of been, the biggest thing that you've had to deal with so far?
Yeah, I think the biggest challenge by far has been the challenge that is plaguing this entire country, which is lack of accurate testing. In a pandemic like this one, what we want to be able to do is testing and contact tracing. That's our best way to sort of pursue that epidemiological best practice and really try to prevent spread. We can't do that without testing. Capacity has ramped up at that offsite testing location for Virginia Hospital Center in Quincy Street, but we're still talking on the order of maybe 100 tests a day and still waiting for a turnaround of at best 36 or 48 hours. So that has really made it hard to deploy the right response that I know our public health team is capable of deploying. Beyond that, I think the biggest challenge that I think about a lot are the consequences, again, of social distancing. It is absolutely the right thing to do. I feel really confident in it. It's how we're protecting our most vulnerable members. It's how we are preventing the hospital surge that really would endanger the lives not only of COVID-19 patients, but others who are seeking emergency medical help. So I don't stay up at night worrying that social distancing or the governor's recent orders are the right thing to do, but I do stay up at night thinking about the consequences. The huge hit that we're anticipating to our fiscal 21 budget. A couple weeks ago, about a month ago, we were attending budget meetings talking about the potential to finally take on some long deferred priorities in Arlington. And that is certainly gone by the wayside. And as well as just, the consequences that social distancing, school closures, and others have on members of our community. I mentioned the economic impacts for people who are losing hours or losing work. There are also the social impacts for people who live alone. The impacts on families that are trying to, educate their kids or keep their kids out of trouble while they're working full time. So I think those are the consequences I worry about most. And, just to make a point, we've talked so much in our public response about seniors and folks with underlying health conditions, because we know they're most at risk. We've talked a lot about trying to be really compassionate for families because they're struggling. But this is a really hard time to be a young professional too. I know I've talked to a lot of friends who are living with roommates with whom they're not particularly close, right? You're far from your family, you're far from your friends. The networks that you rely on to keep yourself mentally healthy and emotionally connected are all being really tested and challenged right now. So I'm thinking about, our young professionals in the community as well when I worry about all of those consequences of social distancing.
Yeah, that is definitely something that I think that a lot of our members here, and a lot of people who are probably tuning in at home can probably identify with. It's been a challenge for us on the programming level, which is why we turned to stuff like this.
So glad you're doing it.
Yeah, so it's really great to hear that that's actually at the top of mind of our elected officials as well. But you spoke on about a little bit of the economic impacts, especially with some of our more vulnerable communities. So really, what ways or programs has the local government been able to help out our lower income, working families, or those who have just been laid off recently? I know that was sort of a unintended consequence of this whole thing. But we're seeing right now in Virginia that we've had more people in the past couple weeks apply for unemployment than we had in the entire year of 2019 in the Commonwealth of Virginia. So just kind of going on that, what you mentioned the small business a little bit, but really what anything if with the workers are we sort of kind of looking at there?
Yeah, absolutely. And I think in addition to folks who are eligible now for unemployment, there are people who've just seen hours dramatically reduced, right? So they haven't been cut from their jobs, but that income that they relied on, certainly people who work in, the tip economy, right, or the gig economy. So we've been really focused on keeping people in housing and with utilities on as much as possible. We've amped up allocations to our Emergency Financial Assistance Bureau. I am going to try to pull up that number while I talk to you also so you know where to call. And that's really important. That runs through Arlington Thrive, and that is emergency financial assistance. As long as you're below a certain income threshold, you are eligible. If you are undocumented or in a mixed status family, you are eligible. And we further relaxed the eligibility restrictions. It used to be that you couldn't receive emergency financial assistance more than once every 6 months or so. Now, even if you've received help, in the last couple of months for reasons unrelated to this crisis and now need new help, you're eligible. And we're monitoring that closely to make sure we don't run out of funds there. In addition, we're also just trying to meet folks' basic needs. Food is the top of the priority list. We've been talking almost daily, the board and the staff and our counterparts at Arlington Public Schools. APS now has meal distribution sites for kids in 5 different locations, and we have been trying to really fill in the gaps. AFAC has stepped up, the Arlington Food Assistance Center, doing significant food distribution. Similarly, has relaxed requirements. You previously needed a referral to get food access. Now folks can just show up and get that food access that they need. We've also stepped up the financial contribution we as the county make to them. Our big remaining question is how to figure out how to get food to the people who can't leave their houses. That's very much a work in progress. We're trying to figure out how to set up a volunteer call center that might be able to do that. So watch this space. We hope to have more to come. But in the meantime, those resources are available at AFAC for anyone, and at those 5 sites around the county for school kids.
I mean, that sounds great. I know that we at Arlington Young Dems actually just launched a little bit of our own donation collection for some of the monetary stuff to help donate to those programs as you just talked about. So that's great to hear that those are running and doing exactly what we want them to be doing.
Yes, thank you for doing that.
Exactly. So, kind of switching gears here a little bit. I know that the biggest thing, to come out of this has been that's been running on the news a lot has been the $2 trillion stimulus package that they've just passed through the House of Congress. So, what do we expect here in Arlington County to have come down our way? So if we can see how that sort of trickles down into the local level, what are we looking for that way?
That is a great question. I don't have the answer to it yet. Our management and finance staff, as well as our federal policy liaisons, are reviewing that to try to figure out what it might mean. All of that aid comes through the state. So the real question is, what will the state disbursement funding look like? A couple of things just to highlight, that the direct-to-consumer checks that are coming, right? Either direct deposit if you file your federal taxes that way, and they have your direct deposit information, or the mailed checks that may take up to 3 weeks. Every Arlingtonian who is eligible will receive those. That doesn't have to funnel through any state process. One of the other things that we're tracking that I'm cautiously optimistic about is that there's pretty significant relief for transportation and transit in particular. It's been a very bizarre thing for me to be encouraging people to not take transit after working so hard over the past 5 years to do the opposite. And we know our transit operators have seen huge declines in ridership, which is good, right? We really want people to avoid non-essential trips and protect those drivers. But we've seen revenue just fall off a cliff. So we actually just voted as the board to accept some state revenue. The Department of Rail and Public Transportation acted really quickly to get state dollars in aid to us. And now it looks like we can expect even more out of the federal relief bill. So the little things that you're grateful for, right, that hopefully, our WMATA system and our art system here in Arlington may not crater as a result of state and federal action.
Yeah, I was going to say that the BRE has definitely been a sort of passion project of yours.
That's
getting
great.
That sorted out while you've been on the transit commission. So I'm glad that people are avoiding taking trains and taking buses, but you're right. It definitely will have an impact there financially. So, but hopefully we can see a little bit more of that in the future. Trying to make sure things continue on past weathering this storm.
Yeah.
So before we move on into some of the questions that we've received or that we're getting, I just want to make sure that our viewers, followers really want to get involved and really want to make sure that they're making the most impact right now, especially for those who are more able-bodied and are able to leave the house. I know that today in Governor Northam's address, he said that you can leave the house for volunteering for nonprofits and things like that. So how can our viewers and followers best help out from a volunteer aspect for the county in any way?
That's a great question. And this is such a volunteer-minded community. It's one of the things I love most about Arlington, and we have been trying to figure out how to enable people to do that safely. You hit the nail on the head. One of the best ways for people to support our nonprofits and our safety nets is to donate right now. That's really hard, right? In part because people's incomes may have taken a hit, and in part because we're used to being a little more hands-on in this community. But it is true that when you leave the house for really any reason, you are putting yourself and others at risk. And so, again, you sort of see those jokes and those memes about, our grandparents and great-grandparents fought in World War II, and instead we're being asked to sit on our couch. But it really is how you can best help other people right now. That said, there are definitely some places that need resources. AFAC that I was just talking about is a great example of a food drive. I know some of our churches, like Our Lady Queen of Peace, have been doing food drives as well. And so when you are on your organized, sanctioned, responsible, hand-washing, filled grocery excursion once a week, if you want to help pick up some non-perishable goods, AFAC is still taking donations and other food drives around the county. The best clearinghouse to learn about all of this is Volunteer Arlington, which is normally our clearinghouse for all volunteer opportunities, and has done a great job stepping up here. So they have certainly plenty of donation links, plenty of links to different nonprofits, Amazon wish lists where you can pick out something and help them out, as well as places where there are drives and opportunities for food distribution too.
All right, great. And just going on that from a different perspective, where should people be going for resources right now? I know that the county has been working on a lot of ways to get that information out, but what, if any, is the best way for people to access that?
Yeah, great question. So one of the absolute best things or best places to go is our website, which is, if you actually just go to arlingtonva.us, you'll see the banner on every page, and you can click on that. You can get to it directly from our public health website, but really just arlingtonva.us. You'll see the banners, or you can search COVID-19 in the search bar. That information, that website is being updated on a almost hourly basis at this point, to make sure that we have all the latest information, that we're ensuring that people are getting specific information. For example, what does the governor's order mean for us in Arlington? Or now that parks and recreation facilities are closed, what does that mean if I want to be walking on the trails? All of those specific questions you can find arlingtonva.us. We have also set up a hotline, which is 703-222-7999. And I think you and Dan are helping me out by putting that in the chat. That is available in English and Spanish, 12 hours a day, 7 a.m. to 7 p.m. And that is a great place for public health information about closures, and all of the other latest details. It is not a individual health hotline. It is like so if you're experiencing symptoms, we really do encourage you to call a medical professional. If you have a primary care doctor, call them. If you don't have a primary care doctor, go to urgent care or call urgent care, for advice. And if you are uninsured, you also are welcome to call the Arlington Free Clinic, which has a hotline as well. That medical professional to whom you talk may very well advise you to stay home if your symptoms are treatable at home, but we really encourage you to give a call to a medical provider before showing up anywhere with symptoms. So the website, that hotline, and your medical provider if you're having symptoms, I think is the best place I can direct people for more information.
Great. So I'm sure that we will be able to circulate those resources out to everybody, even if it's not right now, but after this, after we hop off of this. So thank you for all of that. So now we're going to turn to some of the questions that we've been getting in from our members and our viewers. So Jonathan writes, while we are keeping a pandemic at bay with aggressive and necessary distancing measures, we are unknowingly creating a second epidemic of depression, loneliness, and isolation. These necessary measures, which include the governor's recent stay-at-home order, have no end in sight. We cannot sustain these measures indefinitely without negative mental health outcomes. What will you do to provide for the mental health of Arlingtonians while also flattening the curve for coronavirus? And I think you touched on this a little bit with talking about how some of the young professionals are dealing with things, but what resources out there right now do we have for these people that might be suffering from those mental health issues?
Yeah, Jonathan, thank you so much for asking. This one is definitely on my mind with mental health in general, and then with a lot of related behavioral health issues. We know that this is going to be especially difficult, for example, for people who are in recovery from addiction. Isolation can definitely trigger that. An issue that has been of really significant concern to me is that we anticipate this is going to have a significant uptick in the severity, if not the incidence, of domestic violence in our community. So what I can tell you is that our providers have been working really hard on creating telemedicine options. So if you are a client of Arlington Behavioral Health, or if you would like to be, which you can find by going to arlingtonva.us and search behavioral health, they have been working on telemedicine, counseling and sessions that way. And then I know that Doorways, our nonprofit provider of domestic violence assistance, has assured us that that hotline is still up and running for people to call. You will not be denied shelter if you are leaving a situation of intimate partner violence. If you have symptoms, you may be in a hotel room, but you will get safe shelter, and I think that's really important. And similarly, I know that a lot of private practitioners in the mental health space are working on telemedicine as well. The last piece too, for speaking of sexual violence, for survivors of rape as well as domestic violence, again, being alone can be really triggering. I know that Doorways is working on telecounseling for survivors who are not in acute danger but are wrestling with those issues, as is our FACT unit, which is the forensic mental and physical health unit in Inova that treats survivors of sexual assault and domestic violence. So all of those resources are available. The Doorways pieces that I mentioned you can find by going to Doorways website. The behavioral health pieces through Arlington County you can find by, again, going to arlingtonva.us and searching behavioral health. And I am certainly looking for, again, for those who are in recovery, as I see groups and citizen groups reaching out and providing opportunities, I'm committed to trying to share those as well. Being isolated is a real trigger for a whole lot of issues that people experience with mental and behavioral health, and it's one that we're committed to trying to ameliorate.
Well, it's great to hear that all of those are available. I know that is definitely something that is on top of mind of a lot of people as they are in here and, dealing with this either alone or far away from family. So it's great to hear that. So moving to the next question, Nicole writes to us, University of Virginia and Virginia Commonwealth University said that they have made new tests, and a new 5-minute test is apparently going to be ramping up for production. How do we get the Virginia Hospital Center and also Inova coronavirus tests?
That's a great question. That's really encouraging to hear. I know too that the president's announcement today suggested that there maybe more sort of quick fire tests coming from Abbott Laboratories, which I hope will be the case. I think that mostly you will see our local healthcare providers and Arlington assist them in doing that, accessing any new tests on a regional basis. So there is a Northern Virginia Coalition of Hospital Health Providers that has been meeting regularly, that our public health staff have been part of phone calls with. That is how, for example, we were able to set up the testing site with VHC. It's how we're able to learn about Inova's testing site off Lee Highway. And so as more tests are available, I know that we're going to be able to quick pivot to incorporate them into all of those practices through those regional collaborative bodies.
Great. I know that has definitely been an issue so far with a lot of different areas trying to access those tests. Making sure that we're getting them out speedily to everybody here in Arlington is definitely something that I think will go really far with having to deal with the virus and flattening the curve, hopefully sooner rather than later. Finally, from Stephen, he writes, are you working currently with advocates like A-SPAN to get the homeless off the streets to keep them safe too?
Yeah, that's another great question. So we are really fortunate to have about a 10-year-old point at this point, continuum of care collaboration between our human services staff and those nonprofit providers. A-SPAN is definitely the biggest, but we also know that there are other providers, again, like Doorways, Bridges to Independence, others working on rapid rehousing, Housing First. And so that work continues apace. We are relying on the data that we gather from our point in time count that helps us get a beat on how many people are literally on the streets. What we're seeing more commonly with homelessness in Arlington is couch surfing, people sleeping in their cars. So we're trying to continue to reach out to those sort of known affected folks. And then also really stepping up the cleaning and disinfecting in any of our communal living spaces. The other thing that our Department of Human Services is working on is entering into contract agreements with hotels so that anyone in a communal living situation, whether that's folks in recovery, people in a homeless service unit, or rapid rehousing program, will have the opportunity to go somewhere safe if there is a case of COVID-19 found in those communal settings.
Great. I know that, that's definitely an issue that we've had to deal with here in Arlington. So good to see that the county has a little bit of a contingency plan there in place. So as we're wrapping up here, I just want to say thank you again for getting on and doing this. I know that it's been hard for all of us having to work virtually, but it's great to have you here to talk to our members in a different setting. So I just want to give you a quick second to plug anything resource-wise again. Just everybody has that so that they can take that down and make sure that they have that up on their fridge or something like that.
That's great. Thank you for the opportunity. So, let me run through a couple numbers again. That emergency financial assistance number, if you're having trouble paying your rent, keeping your utilities on, buying food, that number is 703-228-1350. Our public health hotline, if you have any questions from a public health perspective, 703-228-7999. Website, arlingtonva.us. You'll see that coronavirus COVID-19 banner everywhere with lists of closures, the latest public health information. There's a place there where you can sign up for a daily digest of everything coronavirus related and get that information directly to your inbox as well. And I think, the last thing I'll say, just because it's top of mind, we've had some issues with people not respecting our parks closures. So if you know anybody like that, tell them to knock it off. We had some examples of people using wire cutters to get into cordoned off parks this weekend. We know that people are really eager to move around, but we encourage you to do that by walking, running, cycling 6 feet away from other people on our streets or trails, rather than using playground equipment, sport courts, and other things where we know the virus can linger on those surfaces and it's harder to socially distance. So with that, I'll just say thank you guys again. I heard a phrase the other day, this is a little cheesy, but we're physically distancing, we're not socially distancing. We're trying to stay connected to one another. And so this is such a nice opportunity to not only try and share some information, but to stay connected to the AYDs. So I really appreciate the opportunity and everything you guys are doing to stay connected.
Yeah, absolutely. I think that's a great reminder for everybody, just to know that this is something that we should be taking seriously. As always, we encourage our members to also exhibit the same social distancing that is being handed down by the local government and the state government, as well as all of the necessary health and cleanliness that we need to be looking after. So thank you again, Katie. And I just want to remind everybody that we'll be doing this weekly. Next week, we will be talking with Praveen Mann, who is the chair of the Democratic Asian American Virginians. And he also is on the Asian American Advisory Board and is a former AYG president himself. So we are looking so forward to hearing what he has to say about some of the Asian American population that we're doing. that is we're witnessing right now, some of the unintended consequences. So thank you so much again, Katie. Thank you to everybody at home who is joined in, and we will see you next week.
All right. Stay safe.